The reason that I wanted us to gather today is that there have been continuing and multiple incidents throughout our state hospital system that really have risen to the level, for me, they just have to be addressed, and they need to be addressed this year. The call to action for us, in my opinion, is to really confront the regrettable working and therapeutic conditions that patients and staff in our state hospitals are facing every day. Let me just give you a few examples from just the period of May 22nd to May 30th, just this past month. There are several examples at the Napa State Hospital, including a female psychiatric technician staff who was beaten and sexually assaulted in a stairwell where a resident had been lurking, a male hospital staff person aggressively charged and physically assaulted, 2 instances of patient-on-patient abuse, suicidal behaviors that require one-on-one suicide watch, and multiple random physical assaults. Last fall, the Assembly Committee on State Hospital Safety did hold a hearing in Napa to discuss these continuing assaults. And the statistics are that there are a minimum of 3,000 of these kinds of assaults every year. This is just beyond comprehension and needs a response. At Atascadero State Hospital, that is represented by my colleague, Assemblymember Kachu, who is with us today, a individual, a patient there, allegedly murdered a fellow resident just last Wednesday on May 28th. Adam Paul Carey is in custody for that alleged assault that resulted in the death of a patient. This year I introduced Assembly Bill 2144 that would have established minimum staff-to-patient ratios for our state mental hospital system. These minimum staff ratios had been in effect in years past based on a consent decree ordered by the court, but this consent decree was lifted in 2011. The bill, unfortunately, was held on Assembly appropriations suspense, so is effectively dead for this year. I carried this bill because I have a deep understanding of what it is like to be overloaded with cases. I am a professional social worker myself and understand what it is for staff who would like to engage in the profession for which they were trained and for which they were hired, but are unable to carry out their duties because of external factors. Again, unfortunately, AB 2144 is as dead as the patient in Atascadero for this year. However, I think there are things that we still can do, and that's the reason that we are holding this gathering today, to continue to shine a light on these very difficult and dangerous conditions faced by patients and workers on a daily basis, to ensure that we do not forget that there are people who are under threat of assault every day. We must continue to speak out, not only when these incidents happen, but every day until this problem is solved. So what I'd like to do now is to have my colleague, Assemblymember Kachu, who represents Atascadero State Hospital, come and speak to us about some of the work that the legislature is doing and is continuing to try to advance before the end of this legislative session. He will be talking about Assembly Bill 1340 that would establish an enhanced treatment program that will, we believe, try in some measure to alleviate some of the conditions that I just spoke about. We must do something this year in order to address a state mental hospital population that has shifted from largely civil commitments to forensic commitments, which are now at 96% of the state mental health system.
We're going to call on the legislature as well as the administration to step up and do what is right now. They should hold the appropriate hearings so they can gather the information that would give them the background that they would need in order to act immediately. Immediately. We shouldn't, like the Assemblywoman articulated, have people who are being murdered or people who are being maimed or injured in order for them to do what the state of California need for them to do every day, and that is to provide services.